I want to talk about case management a little bit now, clinical management. In my practice, in one nursing home alone, about 250 beds capacity nursing home, I have about 40 COVID positive patients. I have another nursing home, 300 bed capacity, also 45 patient COVID positive patient. My outpatient practice, I have about only 10 patients. They are doing well now. I have 3 patient acutely ill patient intubated, 2 of them intubated, 1 actually passed away. Management wise, a lot of doctors even now here in the US learning. None of them know really this is all about. They are experimenting. Some people say early intubation of patients is very important. They have to put the patient in the machine. Some people say no. Some people say give high pressure oxygen treatment. Some of the doctors would say let's give intravenous heparin at the beginning. Some people say no. So we like a trial and error kind of business. We discuss among doctors about cases. Everybody has different ideas. The basic information most of the people, most of the doctors gather and agreed upon is early intubation, giving intravenous heparin and remdesivir, 200 milligram IV first day and 100 milligram once a day. And also when they are discharged, if they get better, we have to send them home with some kind of medication called Eliquis and make sure blood pressure is controlled and other medical problems that patients are having under control before they get discharged. But outpatient basis here, just because they have positive cases doesn't mean that patient need to get admitted to the hospital. Keep on calling the patient, have a very close contact, telephone contact with the patient to find out how they are doing. If they are having shortness of breath or high fever, severe body aches and pain, then we are advising them to go to the hospital. But most of the people outpatient, they are not quarantined in centers, but they are confined to their own home and with very close supervision as well as contact with the doctors like us. So we communicate with them very well. So the case is not over. We still have a huge pandemic, especially in California and Arizona. And I would say people are talking about second wave. So I want to ask Professor Dhammika Atapattu about second wave.
So second wave is something which the medical population is predicting, which we might encounter in the near future. Second wave is actually man created. It is thought that second wave is due to moving away from the preventive measures like using masks, social distancing, and basically careless behavior, which increases transmission of the virus between people. Now, could some also predict the possibility of the second wave during the flu season, because they think that the coronavirus and the flu virus might coincide or co-infect people who are not immune. That can cause a huge upsurge of respiratory tract infections. That's possible partly because firstly we don't have a good vaccine for the coronavirus. Secondly, the vaccine we have against the influenza virus is about 40 to 50% effective. So efficacy is all for the influenza virus is also not all that good. Combination of all those factors people think might be the reason for the second wave.
In my practice, I did my postgraduate in New York City, one of the busiest city and large number of patients. Even a regular day, we have thousands and thousands and thousands of patients come to the emergency room, get admitted for so many sicknesses. So this corona thing, actually it's like went up at 10 times of population that we usually have in a big city like that. Now Sri Lanka, in case if something happens like that, do we have enough manpower, enough ventilators? Are we equipped with that kind of supplies in our country? I'm going to ask that question. I'm going to ask Professor Sarath Gunatila.
Yeah, when we talk about these second waves, we have to distinguish between a major mutation, as Professor Atapattu was talking about, in which case everybody in the community will be non-immune and they will get it. That is more unlikely than what we are going to experience with this return to work or opening up the economy when we have relaxed the curfew and all these other containment measures. So what you would see, it's not just one second wave, you would see in the community multiple second waves. Sri Lanka actually is facing many challenges here. Number one, we are returning thousands of immigrant workers from the Middle East and from expatriates from other countries, students and other workers. So there is this whole idea and necessity to quarantine those people. The second thing is we are also reopening the economy and starting things in the workplace, and for which we should have a definitive plan where we can't do things as we used to do before. This is what they call the new normal, where they will have to now think of every employee and say and decide these employees can work from home, these employees can come to work for a couple of days, these employees are essential. And once they come into the workplace, then you still have to stagger the work so that there are so many shifts, and you need to get people to work in groups and make sure that when you come into the workplace that there is a temperature check, there is a symptom check, they wear the proper protective equipment, the mask, which is known to reduce the spread of infection. And there is also this question whether the cloth masks are effective. Yes, it is, but the effectiveness varies from the quality of the material that's used and the fitness of the mask. So, but if it is well fitted, made well, the cloth mask can provide anywhere from 40 to 70% protection. But the key here is for the workplace to combine that with social distancing, spreading the work area, containing certain groups of workers to one area, and then giving them all the necessary instructions, making sure that there is no unnecessary congregation of workers, and that they disinfect the place very carefully and make sure that there is a mechanism for them to report any kind of symptoms, and it also will have to be followed up by further testing, and of course then at that point you need to initiate the same control measures that the country is taking right now, that is to quarantine and isolate some of these individuals and manage the contact tracing extensively, exactly like what we are doing. So this is not the time to relax, this is the time to be more vigilant.
So I think we have very successful discussion about this and pandemic and second wave. I really appreciate to come in today, Professor Dhammikatapattu and Professor Sarat Gunatilaka, and thank you. We like to have more and more discussion like this in future. We want to give something to our people in Sri Lanka. Honestly speaking, now look like they are doing extremely good, but if they need anything else from us, we are more than welcome to request any financial help and medical supplies or anything else they need. Thank you.